First, we're going to talk about case selection for veneers. Also, let's review who is a candidate for veneers and who is not a good candidate for veneers. To understand this, we need to think about addition and reduction. Veneers are ultimately an additive procedure. The more additive you can be to a smile, the better. The less reduction you need for a smile, the better. This is a good way to categorize easy versus more difficult veneer cases. So basically, smaller teeth, teeth that need volume or that need to be built out would be more additive. Teeth that are too big and sticking out would need more reduction. Here are 5 ways to help determine if someone is a candidate for veneers versus someone that may need more reduction and or may need more extensive dental work rather than just veneers on their anterior teeth. Evaluate the arch form alignment. Think about the starting position versus the ending goal position of the teeth. Where is it that the tooth needs to be in space in relation to the desired arch form? When we look at teeth from the occlusal, where does the arc of teeth compare to the arc of the goal smile? Next, check for pre-existing decay or existing restorations on the x-rays. If someone has lots of older dental work or weaker teeth, they may need crowns versus veneers. Next, evaluate the occlusal forces and function. Is there mild, moderate, or severe wear or damage to the teeth from occlusal forces? Does the patient have anterior guidance? If not, does the patient need a bite raise or to do more teeth need to be done in order to stabilize a bite? This can alter your treatment plan. The type of occlusion and bite relationship. What type of occlusion does the patient have? Does the patient have a significant overbite or overjet or an underbite? This can alter your treatment plan as well. Ultimately, the more things that are going on with the teeth, the more you have to do to fix them. In cases where there are many things going on with the teeth, we need to think about more interdisciplinary treatment planning like ortho and Invisalign prior to veneers. Or we may have to propose more heavy restorative work like crowns or doing a bite raise instead of just veneers. Now let's talk about what some cases that would be good for veneers versus cases that wouldn't be as good for veneers. Good cases for veneers. Here's a list of conditions that could benefit from veneers or good cases to do with veneers. If a patient has good arch form, the teeth are straight, post-ortho or post-Invisalign, small teeth, gummy smile, even gaps between the teeth, someone who does not show enough teeth, someone who wants thicker or fuller teeth, someone that loves the fullness of a snap-on smile or Invisalign, someone that wants bigger teeth, someone who wants to increase the size of their teeth, someone who wants to build volume to the teeth, teeth that are set back or teeth that are lingually inclined, no fillings in the teeth, no cavities, good class 1 occlusion, no major signs of wear on the teeth, someone who's wanting to replace composite veneers. Ultimately, the best veneer cases tend to be smaller teeth that could benefit from getting extra volume and being added to. Bad cases to do with veneers. Here's the list of conditions that patients may have in which veneers wouldn't work as well or could possibly make things look even worse. If a patient has a large overbite and large overjet, severely crooked and crowded teeth, someone who has longer teeth and they want shorter teeth, teeth that are sticking out, broken down teeth, signs of severe attrition, collapsed bite, significant loss of vertical dimension, teeth with lots of previous dental work or previous crowns, severely dark or stained teeth, tetracycline stained teeth, wanting to change the widths of the teeth, or wanting to move the midline. If a patient shows signs of moderate wear and damage to the teeth, we may have to do treatment on the lower anteriors to establish anterior guidance. If a patient shows severe signs of wear, we may need to consider doing a bite raise and potentially more teeth or even an entire arch to increase the vertical dimension. So the more that's going on with the teeth, the more we may have to prep the teeth. The more that's going on with the teeth, the more likely we may need to consider ortho or Invisalign before treatment to establish a better bite relationship.